Good morning, good afternoon, good evening, depending on where you are in the world. You're welcome to today's episode of Public Health and Real Life. Today we'll be interviewing Devin Thorpe, a philanthropist, a best-selling author, and a new media journalist. And he'll be talking today with us about philanthropy and the global health agenda. Ashwin, over to you.
Hello, everyone. Welcome. A very warm welcome from my side. Maimuna, thank you so much for that introduction. Good morning to our viewers in the US, and good afternoon and good evening to our viewers in Africa, Europe, and perhaps beyond. And I am Ashwin Kadambi. I am a senior global public health professional and your co-moderator today in this exciting program. Maimuna is going to introduce our distinguished guest and lead us through the discussion. But before then, I just want to say a few words about our topic today, which is philanthropy and the global public health agenda. Now, let's step back and review the technical definition of philanthropy. Philanthropy, according to its Greek roots, is love for humankind. The prefix philos refers to love, and anthropos, you have anthropology and comes in various words, refers to human race. So put it together, it's love and care for fellow human being and the human race. But if we take a look at various definitions in the dictionary about philanthropy, for example, on Oxford Dictionary, we see the definition as the desire to promote the welfare of others, expressed especially by the generous donation of money to good causes. Now, that paradigm is changing, and people have there is active conversation among the international community that philanthropy is not necessarily about giving hundreds of thousands of dollars, let alone millions or billions of dollars, but as Destin Bantu in his TEDx youth talk has defined, philanthropy as the idea, event, or an action that is done to better humanity, which involves a sacrifice of some kind. However, in today's topic, we will begin with philanthropy from the lens of the existing paradigm and how we will be moving or how we will move the international community towards going to the better definition. With no further ado, let me turn to Maimuna to introduce our guest and the program. And Maimuna, the floor is yours.
Thank you very much, Ashwin. So Devin D. Thorpe, in 2020, Devin was the Democratic nominee for Utah's 3rd Congressional District. He's a best-selling author, like we mentioned earlier, who calls himself a champion of social good. He travels extensively as a volunteer doing service, as a journalist, finding heroes, and as a speaker, sharing what he's learned. As a Forbes contributor, he covered social entrepreneurship and impact investing, reaching an audience of over 2 million people. He produced 1,200 episodes of his Your Mark on the World show, featuring luminary change agents, including Bill Gates. A best-selling author, his books read over 1 million times, help people use money for good. He has helped nonprofits raise millions of dollars via crowdfunding. He draws on his experience as an investment banker, chief financial officer, treasurer, and US Senate staffer. He earned an MBA at Cornell, and he frequently finds himself on airplanes as he travels the globe. And Devin is grateful to be middle seat sized. Welcome, Devin. To start us off, could you just give a general overview of philanthropy and how it helps shape global health agenda?
Well, it's an honor to be here. Maimuna and Ashwin, thank you very much for having me. And as I think about global health, I probably should frame my experience, because a lot of what I have focused on is the effort to eradicate polio. it then has a lot of relevance to a lot of things. Polio isn't AIDS or HIV, but it has parallels. Polio isn't COVID, but there are parallels. It's been how I have learned a lot about the global health effort around the world as a focus on polio. And part of that comes because I'm a member of Rotary, and Rotary has been leading the fight against polio for almost 40 years. That effort really began as a grassroots effort going back to the early 1980s, in fact, even late 70s. Australian Rotary clubs began partnering with Rotary clubs in the Philippines to begin immunizing kids against polio. And even then, those individual Rotarians undertaking the most daunting and yet maybe inspiring public health initiative in history in some ways. They had a vision that one day they might convince Rotary International to take on this challenge as a global challenge, that others might join, and that one day polio would be eradicated. And now we find ourselves 40 years later looking at their experiences. And what we do see is that, in fact, after about a decade from the first Rotary polio immunization efforts in the 70s by Rotary clubs in Australia, partnering with the clubs in the Philippines to help immunize kids in the Philippines, Rotary International formally took up the challenge to eradicate polio. And they did it somewhat naively. In 1988 or 1985, when they first decided to proceed, they decided they would launch the effort after a fundraising campaign in 1988. And they hoped to finish in 2004. They hoped that polio could be eradicated by then. Now, of course, we all know that that didn't happen. But what has happened has been pretty remarkable. As recently, let's see, that in the very early 2000s, the number of cases of polio dropped below 1,000 for the first time in history. And let's put that into perspective. In the 1980s, there was no polio in most of the Americas and in Western Europe. Polio was gone. It was completely eradicated. And yet there were about 350 or 400,000 cases a year throughout the 80s around the world, mostly in lower income countries. And so by the early 2000s, that had dropped to below 1,000 for the first time. Now it's fluctuated ever since then. And in, I think, 2017 or 2018, the number of cases dropped to 36 or 37. Not 3,600, not 36,000, 36, right? So it was a tiny number of cases. Of course, what we then saw were some challenges, violence against polio workers. This is mostly young women that are being murdered because they are doing polio immunizations. It's just horrific to think about. And in Pakistan, that's what was going on. And so Pakistan and Afghanistan are the only countries where that are considered endemic polio countries at this point. The progress has been tremendous. The pandemic has not helped. And so we'll probably see, so last year there were about 300 cases. We're hoping to improve on that this year. But what we see unequivocally, is that when people make an effort to improve public health can be improved in dramatic ways. I have visited a hospital in India where polio patients were treated, polio survivors. And it's just tragic how polio can be devastating to a life. And it's inspiring to see now the efforts underway to help people who have experienced polio to recover and carry on more normal lives, to get the help they need to be able to stand, to walk, or to at least get around in a wheelchair, so that they're not left crawling on the ground, which is what has happened in so many low-income countries around the world. So global public health efforts do work. It's exciting to see that. And of course, a lot of what drives that is philanthropy. But I look at polio as a success story, and part of what has driven that success is a combination of the work of local people on the ground in their own communities, helping to guide and develop the successful plans that work. And so, for instance, in India, we saw the coming together of all kinds of things, but among them were volunteers from Rotary around the world, local Rotarians and international Rotarians volunteering their efforts, funding from the Gates Foundation, funding from nations, the United States and Western European nations especially contributing, Japan and others as well. In recent years, the funding has started to come from some of the oil-rich countries in the Middle East as well. That funding was provided in India. And then we also saw that the linchpin piece there was the Indian government at all levels participating fully in the eradication efforts. And so we saw local, provincial, and national governments cooperating in the effort with WHO, UNICEF, and Rotary and the rest in this global coordinated effort, and polio was eradicated in India. But it was that complete cooperation of all the players coming together to make that happen. So anyway, I am excited about global health and the way that philanthropy can influence lives for good through an effort in public health.
That's really a great overview, Devin. And it's interesting because you mentioned the Gates Foundation, you mentioned Rotary, you mentioned local ownership and sustainability. There was a paper by Byrne and Richter, and it was labeled U.S. Philanthrocapitalism and the Global Health Agenda. Rockefeller Foundation, Gates Foundation, the past and the present. That paper really talked about a lot of the things you mentioned with the impact of philanthropy in driving global health agenda. But then it also critiques how some of those, the philanthrocapitalism aspect of it, can drive maybe an imbalance in addressing needs versus meeting CSR requirements and a host of other things. So would you like to shed more light on that piece?
Well, yeah, there are challenges in the way this all comes together. And one of the great, I'll give you an example of one of the weird pressure points that comes through this especially the scale of public health initiative. So in 2008, 2009, India was really challenged. The number of polio cases was increasing. They had been down in the low hundreds and earlier in the decade, but the number of polio cases was up near 1,000 again in India alone. And progress was really stymied. And so the country received an offer of a grant from the World Bank. I believe it was a grant. It may have been a loan, but I think it was a grant for, I think the scale was $59 million. But the requirement was that the grant be used to purchase a bivalent vaccine from I believe it was a U.S. manufacturer. And the Indian government, and I spoke with the health minister who made this decision, who was there. And I apologize, I'm forgetting her name now. But a brave, courageous woman faced with this decision chose instead to turn down the grant and buy the vaccine using public funds instead from Indian manufacturer. And from the moment she made that decision, the final case of polio in India was 24 months away. 24 months away, polio was eradicated in India. And a lot of people thought India would never be able to do it. If there was one country that couldn't, a lot of people thought it would be India because of the massive population and the extreme poverty and the population density in some places. Those all work against eradication of polio, but they did it. They did it. So it's very exciting, really, to see that outcome. But that, in a way, I think is a perfect example of the tensions in global health and philanthropy, right? Oftentimes the public health agenda of countries, and whether you're talking about China or the United States or Western Europe, oftentimes countries tie aid to the purchase of products, materials, or services from the country offering the aid. I see that a little less often with the private philanthropy. Private philanthropists tend to be a little less that way, but there is a little greater risk, at least as perceived. I haven't observed this, especially in polio. I've not observed this at all. But the fear with philanthropy, of course, is that philanthropists will arbitrarily choose the problem to solve without adequate consultation of those they're trying to help, which would, of course, be counterproductive. Now, what we're seeing with polio, despite some of the complaints, my firsthand experience in visiting India, Ethiopia, Pakistan, and talking to public health officials at the Gates Foundation many times, including Bill Gates himself, and in talking to people at UNICEF and WHO, and of course Rotary. What I don't see that top-down approach. What I see is a bottom-up approach. What I see is people working on the ground and coordinating their efforts at all levels of government and all levels of these global organizations. And so I see a huge model for success. And one of the reasons I think there has been so much success is that the real players in this organization they coordinate through an organization called the Global Polio Eradication Initiative. And that initiative does not have a leader in a formal sense. It has 5 key partners: Rotary, UNICEF, the WHO, the CDC, and the Gates Foundation. And no one is really in charge. And so they're making decisions in a collaborative, cooperative way. And I like to come back to Rotary, and I apologize for sounding a little bit like a Rotary commercial, but the fact is, Rotary has 1 million members, over 1 million members around the globe. And so in almost every country where they have worked to eradicate polio, there are Rotary clubs, people on the ground in the communities that are providing incredibly important relationships to local public health officials, guiding local decisions. And so what we're seeing is not so much a top-down, but a very egalitarian, cooperative model. And of course, not every public health challenge will be addressed that way, but it is a really successful I think, good model for how public health ought to be done.
You actually raised a very great point, and it's the perfect segue to the next question where I was going to ask that one of the criticisms of global health, like you rightly mentioned, is that, corporations or donors have their own interest, or they basically have to cater to their bottom line. But then you have the populations that need to be served, and they have their own unique needs that have to be contextualized. And you've given a perfect example of the polio model with all the different players and the collaborative approach. We are facing a global pandemic now. Do you think there are lessons learned from the polio model that could be leveraged or could be translatable to handling of the pandemic and how governments should respond?
I just say.
Oops, Ashwin, you accidentally muted yourself there.
Oh, here we go. I just want to welcome our new audience, and I just want to say that we are speaking with Devin Thorpe here about advantages and criticisms of philanthropy's role in global public health agenda and how philanthropists can support implementing internationally agreed to goals and commitments to advance global health. And the question that Maimuna just asked is, can lessons learned from the polio, not eradication, but the polio or getting towards polio eradication campaign be used towards this pandemic's response, and how philanthropists are responding to this pandemic?
So, yeah, I think there's no question that there are lessons we can take away from from polio to look at how we address the global pandemic that we're facing now. There is an effort ongoing now to make sure that we are addressing the pandemic in low-income countries. And I think that is clearly one of the takeaways, right? No one in the world is safe from the pandemic spread and its impact until everyone in the world, the whole entire world, is safe from the pandemic. Now, the nature of this pandemic is a little bit different from polio and measles and a few other diseases, because it's pretty clear that humans can transmit this disease to some other critters, and they can in turn communicate it to us. So it seems likely at this point, based on what we know, that we can never eradicate the coronavirus, the COVID-19. We can dramatically reduce its threat as a public health concern using vaccines, but that will require, almost certainly at this point, based on what we know, I think we've got to make sure that we get people around the world vaccinated. And at this point, because of what we know, what we see, we really need to vaccinate everyone. There will be a very small number of people that for whatever reasons can't be vaccinated because of their own health concerns. But we've got to get everyone vaccinated. And there is an ongoing effort to provide vaccines philanthropically to low-income countries. That's incredibly important. We've got to make sure that every country, not just the wealthy ones, are immunized against COVID. But that will probably have to be an ongoing effort. The coronavirus doesn't mutate as rapidly as the flu, it appears, but it does mutate, right? We're seeing already these various variations. And so far, many of the new strains have proven to be more threatening, either because they are more transmissible or they cause greater illness. So the next phase is that we will probably have to have booster shots periodically. And whether that is annually or every couple of years or 5 years, we'll see what how often that needs to happen. But again, we're going to have to continue to make sure that low-income countries are provided with the vaccine. Now, among the lessons that we take from polio eradication efforts, we see that it is really vitally important for low-income countries to be given opportunity and responsibility to govern a lot of their own programs. And so that's part of the challenge, right? To help figure out how to best help countries take care of their own people. The last thing we want to see is a large, relatively low-income country, moderate-income country like Nigeria, for instance, with almost 200 million people, choose not to vaccinate its population because it hasn't had an outbreak in a while or isn't particularly threatened, and then have a massive epidemic in that country. So, yeah, there's a lot to sort out, a lot to figure out, but certainly we see that the best outcomes come when we all come together and coordinate and collaborate on these vaccination efforts.
You interestingly, I'm from Nigeria, so you mentioning Nigeria is really intriguing. You do raise a great point about vaccinations and ensuring that people have access to vaccines. There has been the ongoing conversation around vaccine equity, and that the rich countries are buying up all the available vaccines, which is going to be leaving low and middle income countries struggling to procure vaccines. COVAX has been initiated to help address that, but then there's still other issues around access still, trade wars with EU and Brexit and all of that, of course the actual cost of getting the vaccine, storing the vaccine, and helping build infrastructure to support the cold chain and the vaccine immunization processes. So what role do you think organizations and corporations can play in ensuring vaccine equity to handle the pandemic?
Corporations are critically important to this effort. But I think we would be naive to think that they will spontaneously act charitably or in the best interest of the world. Corporations are structured and focused to provide, to look out for their own interests particularly. And I know the people at these large corporations are good people, but the corporations themselves are structured to optimize income. And so it is imperative, it is absolutely imperative that we look to other players to help us solve these equity problems. That may mean that we look to organizations like the Gates Foundation and the multilateral organizations like the WHO and UNICEF to help us make, of course, and COVAX, to make sure that we get these vaccines out, because the corporations simply will not do it. That is the sad fact of the matter. They will all do some, but collectively it will not be enough. And so we will need to find other ways to do that. Governments and philanthropists coming together and collaborating. Middle-income countries, I think, will be expected to pay something for their vaccines. Low-income countries, I hope, can get them for free. But somebody has to pay for those, and it'll be a real challenge of us coming together to make sure that we get them to them in a fair and equitable way. And there are huge challenges, right, in trying to decide who decides all of those things, right? But there are some processes, and I think good people making some of those decisions. I've had a lot of exposure to the Gates Foundation, and I really think that despite the caricature of billionaires, what I see at the Gates Foundation is thoughtful, exceptionally smart public health professionals like you two, who are working hard to do exactly the right things, and in a world where figuring out what those right things is sometimes difficult. But yeah, we've all got to come together and work together to figure out how to get everyone in every low-income country in the world vaccinated, so that we don't have people dying undiagnosed from COVID around the world.
Thank you, Devin. That's wonderful observation. And could you please share your experience with Bill Gates? I know you have spoken to him multiple times on your show, and so just wanted to kind of also, if you can highlight what are some lessons to be learned from Bill Gates and the Gates Foundation that other philanthropists can kind of follow. Because if you see, as you said, Bill Gates has a team of public health professionals to advise him on where his money must be going to. So in that fashion, just like billionaires and millionaires, philanthropists in general have tax professionals, they have accountants. Similarly, should they also have a philanthropist executive to kind of advise them around where that money should go, so that it's not only about like they're kind of closing the need gap, but also it should make sense even to them eventually, that they have given to an important cause towards development of a particular cause, or getting closer to a internationally agreed to commitment. In that arena, I just also want to add if there should also be an international body that kind of advises, or if there's already one, that kind of has non-partisan, non-governmental information that says, hey, these are, I believe the University of Washington already has it with the IHME, they have the data from all over the globe about the prevalence and incidence of diseases globally throughout the history since 1900, I believe. So similarly, about what are the development agendas in each country and where the money should go, and that there's a structured implementation of these commitments.
Yeah, those are great questions. Let me see if I can't pick that apart just a little bit and at least address some of those issues. But first off, my experience with Bill Gates, limited as it is, I had him on my show and visited with him in a face-to-face setting for about 20 minutes. And my experience with him is just like what you see on television most of the time. He's kind of an aw shucks, unassuming kind of guy. It's interesting in that regard. He was just that way. Before we started recording, we talked about going to Hawaii, and he talked about playing bridge with Warren Buffett. I mean, he's just kind of a low-key guy. But the remarkable thing about Bill Gates is the combination of, and it's sort of ironic, but he calls himself impatient, and yet he really is truly patient. He is an optimist, but he sometimes has learned from experience to think about the worst case scenario and what to do. So going back about a dozen years, he got serious about developing a new polio vaccine. There have been two basic polio vaccines around for a long time, one created by Jonas Salk, the other by Sabin. And they were remarkable competitors. And the Salk vaccine is an inactivated virus that is an injection, and the Sabin vaccine is an oral vaccine that can be delivered with drops. And they each have their advantages. But Bill Gates saw that they were, even in combination, not perfect, and that the world needed a third vaccine. And so he began working on that a dozen years ago. And now that vaccine is in circulation and is playing a key role in helping us to combat the circulating vaccine-derived cases of polio around the world. The remarkable thing is that when he began thinking about this, everyone in the polio fighting community would have said, polio will be eradicated before you can develop the vaccine. It's too late. We don't need it. And so his foresight, his, in effect, pessimism was invaluable, and I think will play a key part in closing the final chapter on polio over the next 24 to 36 months. His patience at being willing to say, I'm, in a situation where everyone said we will be done with polio in 3 to 5 years, he said, I will now begin an 8 to 10 year process of launching a new vaccine. That is remarkable. And so I think those are some sort of personal lessons we can take, recognizing that, in fact, things can, in global public health, if 2020 taught us anything, it is that things can really go bad quickly, right? It's the kind of thing movies are made about, and for good reason. It is really scary stuff. And 2020 is a reminder that we are not somehow magically immune from really bad things happening because of our technology or development or anything else. Our wealth can't protect us from a new virus. So that's been, I think, a really good lesson for us to all remember that things can go bad, and to be always looking for how we can do things better in the future. So talking about, how we go forward in an equitable way, I think we need to recognize that all of us are philanthropists. Some are bigger philanthropists than others, but I know both of you have almost certainly donated at one time or another $20 to this or that cause or organization. And so you are philanthropists. You've donated time. I have as well. And most people in the world have given time or money to a cause. So all of us are philanthropists. We're all making decisions based on imperfect information. And you and I may make, and I hate to assume that you're making small contributions. Maybe you're both millionaires and I don't know it. But assuming that, like me, you're not, you're making modest contributions. That's great. But we all make our contributions with imperfect information, and that is going to be a challenge that philanthropists always face because they work somewhat independent of democratic structures. That said, democratic structures are not perfect allocators of resources for especially global public health initiatives. I look at my government as a great example of that. Most Americans believe that we give too much foreign aid, foreign assistance. And most people believe that we're giving much more than we're giving. And so the reality is we're not giving very much. And most of the countries outside the United States certainly believe we should be giving more. So democratic countries alone are not the perfect solution, because democratic countries will probably never vote to give as much as they could, or what you and I might agree should. So we've got a challenge there, that governments are imperfect, and multilateral organizations like the WHO and the UN and all are helpful, but again, aren't perfect, because they still have to extract money from countries who may feel, for varying reasons, that they can't help. So there is, as far as I can tell, no perfect solution, but continuing to work together, to collaborate, to cooperate, to talk, to have these discussions, to rely as much as we can on experts, especially experts who are not beholden to moneyed interests. I think most corporations are run by good people and are willing to help to a point. And it's up to governments to help us sometimes cajole and corral them into doing the things that they need to be doing to help fix global public health issues. But anyway, yeah, it is public health. Global public health is probably the best example of the challenges and limitations of all of our relief systems. There is no single best, perfect solution operating. And we just need to continue to talk about how we can do everything that we're doing better.
Thank you for those observations, Devin. Those were fantastic. So I welcome to our new viewers who have just joined us. We are talking about advantages and criticisms on philanthropy's role in global public health, and how philanthropists can support implementing internationally agreed to goals and commitments in regard to global public health. So, Devin, thank you for that explanation in terms of that, the system might not be perfect, but we are all working towards making it better. And one note is, I'm not a millionaire. I don't know about Maimuna, but just a little joke there. In terms of the philanthropy, we have various actors in the global health. And where do you see yourself fitting in? And also your motivations and interest towards alleviating and eradicating extreme poverty, climate change, promoting social justice. Could you talk a little bit about your childhood and your professional years, and what motivated you to fight for these incredible causes?
It's been an interesting journey. But really, it's interesting you ask about my childhood. I did have a childhood experience that really frames my thinking and my decisions. As a child, my father invited me to join him on a kind of a humanitarian relief mission to a neighboring state where there had been a devastating flood. And we went to that community and we dug mud and muck out of basements and helped people for just one day. But I was an 11-year-old kid, and I was profoundly changed by that experience. Now, as I reflect on it, I recognize that I probably was of no use that day. I didn't do any good. But I felt like I had done good. With my little 11-year-old brain, I thought I'd changed the world. I've gone back. There is no statue of me in that town. I was very disappointed. but the reality is it was a life-changing experience for me anyway. And so when I reached kind of the middle of my career, I took the opportunity to step away from focused on making money the best way I could, to focus on having the most impact I could. I started by writing a book called Your Mark on the World about using our money for good, and devoted my life to writing and speaking about those things. And quickly, I decided that I needed to focus on the world's biggest problems. And I started saying that. And then people would say, well, what are the world's biggest problems? And I would say, well, it's public health, poverty, and climate change. And so that's how I began to focus on those three areas. And they're all interrelated. It's not hard to see quickly how climate change that threatens tens of millions or maybe hundreds of millions of people who live in climate threatened areas, either coastal areas or areas like Somalia and Ethiopia and Kenya, where an encroaching desert is making, the Horn of Africa almost uninhabitable. And yet there are a couple 100 million people living there. And so we're driving these mass migrations of people across Africa, across Northern Africa, into Europe. Tremendous health and poverty impacts, political tensions. The results are devastating, and we are just beginning to see the impacts of climate change. And so all of these things come together. They all work together. We as public health people need to be thoughtful about climate change, because we really can't ignore it. I think, I have heard a few people try to blame COVID-19 on climate change. I think that's a stretch. So that, it's not that they are not one topic; they remain three topics, but they are clearly interrelated. And I think it's imperative that all of us think about what we can do in terms of all three areas, because clearly rich nations can be a little bit glib about all of these problems. I mean, here in the United States, part of the reason that we have had such a bad time with the pandemic is that it's hard to convince Americans to take it seriously, right? They're not doing universally the things that they should be doing. Part of the reason I think we've seen fewer problems in Asia with the pandemic are that people are more willing to do the things that they have to do. They're more trusting of the experts. They're more willing to wear masks. They're more willing to isolate. So there are a variety of things, but we here in the United States have got to do a little better in that regard. And so anyway, we've got to just do better. And so these three things come together in my mind as all needing to be addressed, all needing to be corrected, and because they do interrelate.
Thank you. I mean, it's just incredible where the 11-year-old boy has started and where he is going. It's just really incredible to see the kinds of things that you're doing and trying to make your life well lived and worth living. And that's just incredibly inspiring.
Well, thank you.
Thank you for all the work that you're doing in this world, Devin. I had a question, but let me turn to Maimuna before I go with my question. Maimuna?
Yeah, no, just echoing Ashwin, Devin, that's a very inspirational story. And now I'm asking myself that I better go get my boys working so they make their mark in whatever way they choose to. You raised some very interesting points about public health, climate change, funding, upbringing, a lot of things. So, that philosophical saying that says, he who pays the piper dictates the tune. There's been a lot of talk about decolonizing global health and ensuring that, there's more local ownership, there's dignity of recipients and, people from underserved populations. In your own experience, how do you think we can find that balance between how we dictate global health agendas because, rich countries are funding those initiatives and we ensure dignity of the recipients?
This comes into really sharp focus for me because the worst of colonialism is probably the European the words escape me. There's no way. The challenge is I cannot express this thought without offending someone. But the reality is the Europeans who came to what is now the United States conducted what can only be described in hindsight as genocide of the native people who were here. And the oppression of Native Americans for centuries has been horrific. And we saw in public health terms the devastation of the pandemic among Native American peoples, especially right here in Utah. Here in the Western United States, the Navajo Nation is the largest population of Native Americans who are living on their ancestral land. And so it is an interesting, unique spot in the United States, certainly. And what we saw is that the Navajo Nation was devastated by the pandemic and continues to struggle with the pandemic. I did see finally first that one of the very best bits of news is that good news out of the Navajo Nation is that the most well-vaccinated town in Utah is a Navajo community. And that is the first good news that I've heard out of the Navajo Nation really since the pandemic began. And I've spent a fair bit of time over the last 12 months, in part because of my political campaign, down on the Navajo Nation, getting to know people, providing relief where we can. I've delivered some food. I've got some clothing for the Navajo people in my car right now. This minute, I'll be taking it down this week to the Navajo Nation to provide some additional help. But, the solutions are difficult. Again, I think this idea, this notion of decolonizing public health, global public health around the world is critically important. What I'm seeing right here in Utah is a painful reminder of the impacts of that. But the solutions are not easy, right? The Navajo Nation lacks the financial resources to address this pandemic, independent of the broader United States. But that is in part because the broader United States has treated the Navajo Nation so poorly for centuries. And so we've got to figure out new models, better models for the Native Americans specifically, but also more broadly for former colonies and other low-income countries around the world that are struggling, and yet they cannot be expected to solve all of their problems alone. But we've got to find models for supporting them that recognize their sovereignty, recognize their independence, recognize their brilliance, their cultural contributions, their scientific contributions, their rights as human beings. All of those things provide a little tension on how we proceed. But it is wonderful that in 2021 we're having those conversations. Because we weren't really thoughtfully having those conversations 50 years ago.
I just wanted to add to Maimuna's question, where we are shifting from this top-down approach to bottom-up approach, where we are seeing a shift in this past decade, especially with crowdfunding. And I know you have been involved very much in that space. Could you please share your experience and where do you see the future of philanthropy? Is that, of course, it's going to be a balance of bottom-up and top-down approach. So where do you see the future of philanthropy? And also if you can highlight on a few of your experience in the crowdfunding arena.
Yeah, well, I think you've hit the nail on the head, Ashwin. The future of philanthropy is both top down and bottom up, and but the philanthropists will always have the temptation, whether we're talking about $20 philanthropists or $20 billion philanthropists, we will always have to fight the temptation to dictate the terms, to decide who wins and who loses. And we've got to, you said, he who pays the piper names the tune, right? We've got to allow those who we hope to help to name the tune and then pay the piper to play that tune. That's really the challenge for us going forward. And that's going to be a difficult thing for us to get to. But I think the Rotary example with polio is an example of that working quite well. Maybe not perfectly, but quite well. And so I think there is a model we can look to say there is a way for us to be guided by people who are on the ground, by local people, and to respond to local needs that way. Now, crowdfunding is an exciting tool. In some ways, this is a variation on old themes. Nonprofits have always relied to some extent on small donations. What we're seeing because of the internet is that a very small sample of crowdfunding campaigns can raise vast amounts of money. Not all of them do. In fact, the vast majority raise relatively little money. So, for instance, the ALS challenge, the Ice Bucket Challenge a few years ago, right? Even Bill Gates, dumped ice on his head and donated. I think he donated, I don't want to misstate, but I think he donated $100,000. Oprah Winfrey did the same thing. So a lot of big stars did it. And the interesting thing is they were not asked, right? They didn't get a call from the ALS Association saying, would you please do this? No, they just did it like I did it and you may have done it, right? It was this global wave. And so the ALS Association in the course of a summer, essentially raised more money than they had in the history of the organization. And it's something like 30 or 40 times as much as they had raised the prior year. It has not happened again. It will, nothing like that scale has happened again. Every nonprofit in the world tries to figure out how to make that happen. What I have focused on is that there are some things that nonprofits can reasonably do to assure that if they need to raise $50,000, they can do it. And in an interesting test of that thesis, I led a crowdfunding campaign for the Utah Food Bank this month. And last month we raised $72,000 in about 10 days. And it once again proved that there are steps that you can undertake that are predictable and that will allow nonprofits to take advantage of small donations and raise significant, but not overwhelming amounts of money.
Yeah, it's still an awesome in terms of the story of even the 72,000 in 10 days. It's no small money, and it's an incredible feat. Maimuna, over to you.
Yeah, just echoing Ashwin, that is just phenomenal what crowdfunding and just the power of social media can do. So along those lines, with the rise of social media, the pandemic forcing a lot of remote work, accelerating innovation in artificial intelligence and all of those automated learning, where do you see the future of philanthropy?
Yeah, it will continue to evolve. I hope, personally, that the model of government that we see varyingly throughout Western Europe, with greater government intervention, greater government participation in our lives, greater taxes, seems to yield the best outcomes. So it's painful for me as an American to talk about another place. And many of my American friends are offended by the idea that we could learn something from countries like Sweden or Denmark. And I visited Sweden and Denmark in 2019, and they're wonderful places. And that it is an interesting model. I fear that in the United States, some of my compatriots would like to experiment with underfunded government. And I think what we see with underfunded government around the world, that experiment has been tested over and over and over again, and it does not yield good government. It does not yield successful outcomes. I hope that in the United States and in other countries, we can look at the most successful models. And what I'm seeing is that they are democracies. They are capitalist countries by and large, but with activist governments that tax their people enough to be able to provide a social safety net that is broad and protects the vast majority of the residents of those countries from poverty and public health challenges. Now, no country is perfect. I don't think we've found the perfect model yet, but I'm hoping we can do that. That said, even in that world, there is a need for philanthropy. So I don't think philanthropy ever goes away. I hope we will get closer to that world where governments around the world are adequately funded, where people have dignity and liberty, that those are not in conflict. The people in Western Europe, by and large, think of themselves as living in free countries where they have a vast array of rights, but they also have a lot of social protections. But still, there is need for philanthropy. And I hope that in that world, we won't need philanthropy as much. Certainly, there is less philanthropy going on in the U.S. model in Western Europe, and for a variety of good reasons, because the states are doing more of the care. But so that's kind of my view of how I wish it would go. If it doesn't go in the direction I want, then what we could see is a continuing trend toward a division of haves and have-nots, and the haves will continue to give to philanthropy, and we will rely on their largesse to solve social problems that might otherwise have been solved by better government. So anyway, I hope we can continue to have conversations about how to do philanthropy better. I think Bill Gates is an easy target. I continue to see him as a role model for other philanthropists, and think we can all learn a lot from him. Even if he isn't perfect, I think we can all learn a lot from him and from each other, by having these kinds of conversations. So, sorry, I rambled on too much. Thank you very, very much for having me. It's been just a joy to have this conversation with you.
No, thank you, Devin. The pleasure is actually ours, and I'm sure our live audience have really learned a lot listening to you. For me, I keep asking myself, what is the end goal, and how do we ensure sustainable funding? And I think you've touched on it and mentioned it, that we all have to keep working towards not relying too much on philanthropy. That will still be the norm for the foreseeable, I would say maybe 10, 15 years, but really look into how democratic structures, like you had rightly mentioned, and governments and societies would work towards ensuring that their citizens and their populations have adequate social protections, because that then allows for the health of the populations. We are wrapping up now, but for anyone who happened to join late, this is Public Health in Real Life series, and we've had the pleasure, absolute pleasure of speaking with Devin Thorpe. And the topic today has been philanthropy and the global health agenda, and how philanthropy drives global health agenda. We talked about the challenges, we talked about the success stories. We highlighted the bright spots with all the coalition that works with polio, and how polio is on its way to being eradicated across the globe. So thank you once again, Devin, for joining us. Again, it's been an absolute pleasure having you, and we hope that you can join us again sometime soon. Over to you, Ashwin.
Thank you, Devin. Thank you once again, especially for not shying away from the hard conversations, and for providing your frank and plain views, and also for the incredible and extraordinary work that you're doing with multiple organizations around the world, and spreading that and exuding that positivity and inspiration. So again, thank you so much, Devin Thorpe, 2020 Democratic nominee for Utah's 3rd Congressional District, focuses campaign on public health, climate change, poverty, and social justice. Best-selling author, new media journalist, champion of social good, and former Forbes Contributor. Thank you once again.
Thank you. Thank you. It's been an honor to be with you today. I'm very grateful. Thank you.
Just before we go, Devin, if any of our audience would want to reach out to you, what are your social media handles?
Yes, I'm most active on Twitter using the handle @DevinD.Thorpe, but I also have a presence on Facebook with the same handle, and on Instagram. I'm also on LinkedIn, linkedin.com/in/Devin Thorpe.
Perfect. Thank you so much, Devin. Once again, thank you for just lending us your time and expertise. We wish you the best in your endeavors, your political career, and everything else.
Thank you.
Thank you. Thank you to everyone, especially our audience, for their incredible questions and participation. And we look forward to seeing you soon again.
Bye.